So I want to start with sharing the news that you all saw that we had put a statement out shortly ago, and certainly in follow up to the guidance from both on the federal level from the FDA and the CDC, that Washington State Department of Health is pausing the use of Johnson & Johnson, J&J vaccine statewide starting immediately. And as you know, we are doing a lot of things behind the scenes, as you can imagine. One, communicating and talking through with our federal partners to recognize and understand what they are seeing and what their concerns are, and then certainly communicating with our local partners as well as those who have received a Johnson & Johnson vaccine in the state of Washington. And then certainly we want to make sure to communicate information to our community members, especially individuals who may have received the Johnson & Johnson vaccine recently. As you know, the FDA and the CDC have asked for the vaccine to be put on hold until we have additional information and guidance coming from our federal partners on how best to move forward. And what I wanted to emphasize are a few things. First of all, that this action is being taken out of extreme caution and based on the appearance of a rare, very rare, and we will talk about that in terms of how rare of a side effect, but a serious side effect, which includes blood clots, which can be in different parts of the body, including the brain. It can be in the abdomen or the belly. It can be in extremities, etc. But that is a very rare occurrence and happening in individuals. And thus far, it's been 6 individuals from overall 6.8 million doses that have been administered across the nation. So it is a less than 1 in a million chance of this side effect based on the information we have. It's blood clots combined with low platelet counts in these 6 patients, and all were women under the age of 50. They were between the ages of actually 18 and 48. And these were individuals who developed these blood clots. And again, they were associated with what we medically, Dr. Lindquist and I speak with our medical providers on. It's a condition called thrombocytopenia, which means low platelet counts. So individuals with low platelet counts who developed a rare side effect of blood clots, and these were all women between the ages of 18 and 48, all were under the age of 50. So 1 in a million occurrence means that this is very rare. Now, we do want to recognize that the federal government, our partners at CDC and FDA, jumped on this very quickly. And they did this because they wanted to make sure that they were getting information out to the community and the public. But I also want to recognize another very important reason that our federal partners went forward with this was that they wanted to give medical doctors and clinicians and healthcare providers enough information on how to treat an individual who might come to them with post-vaccine, with symptoms that would make them concerned to seek care and then determined to have a blood clot. And that's where they were wanting to make sure that the doctors and the healthcare providers had enough information so they knew how to treat those conditions. And the reason that I say that, and Dr. Lindquist will go into more detail, but when you have thrombocytopenia, low platelet counts, and blood clots, if you treat with a medicine called heparin, it actually can be potentially more dangerous in that kind of a circumstance. And so you have to move forward with different kinds of therapeutics. And so this pause allows the CDC and our federal partners to get information out to medical doctors and healthcare providers on how best to treat individuals who may come forth and say that I'm having symptoms and are determined to have a blood clot. These obviously are adverse events that are very rare. They're unfortunate, but it should not take away from the fact that these 3 vaccines that we have are safe and effective. And this rarity of this side effect, again, 1 in a million, while serious, it has to be reminded to everybody that this is rare in and of itself. And the reason that I'm saying that multiple times is that we want to make sure that people continue to have confidence in vaccines and they recognize the importance of those vaccines. To our partners on the ground, we already had a conversation earlier today with our local health jurisdictions, and we discussed this very issue. And we told them we were getting more information from our federal partners, and we reminded them the importance of if they have Johnson & Johnson vaccine that they've received or in their communities, that we do not want that vaccine to be administered at this time until the pause is lifted. We're also being told by our federal partners that that should be a matter of days, maybe a week or a bit longer, but it should not be longer than that. Again, one of the big reasons that they wanted to put the pause in place was so they could have a discussion with healthcare providers so they knew how to treat this potential complication. The other thing that we told and talked to our public health partners on is the importance that if somebody in their community has received the vaccine, what we would like for them to do. For those who have received the vaccine more than several weeks ago or a month ago, the risk of the complication that we're discussing here, the blood clots, is very low. But people who have received the Johnson & Johnson vaccine over the last 2 to 3 weeks and who develop severe headache or abdominal pain, leg pain, or shortness of breath within those 3 weeks after vaccination should absolutely contact their healthcare provider. So it is really important that as we talk to our community members, that we make sure our community members know that the vast majority of people that have received Johnson & Johnson vaccine will not have any side effect. But there are cases in a very rare instance where they may, and we want to do everything we can to connect them with their healthcare provider. The final thing that I would just want to make sure that we recognize is that we're now at the Department of Health going back and looking at where J&J vaccine was shipped and delivered, where it may have been administered, so we can make contact with those providers directly. We're going to ask those providers to also connect with the individuals that they may have administered a vaccine, if necessary, to get information out to them so that they can have good information, clear guidance on what they should be on the lookout for. We're obviously going to have more information on our Department of Health website, and we're also going to be putting information on social media. And so we would just ask for you to amplify that message into the community. The main message is that we are now on pause with the Johnson & Johnson vaccine, pending getting more information from both our federal partners as well as on the vaccine itself. Also, we recognize that this is a very rare side effect, 1 in a million, and it is absolutely critical that we emphasize that one of the reasons that the federal government and our federal partners went forth with putting this pause in place is they wanted doctors and healthcare providers to have enough time to understand how better and best to treat if somebody comes in with these symptoms. We're working with our partners so that we can identify where the vaccine has gone and also work behind the scenes so that they are not delivering or administering any more of that vaccine until the pause is lifted. And finally, to our community members, if you have received the Johnson & Johnson vaccine over a month ago or over 3 weeks ago, you should not be of concern. It's those individuals who may have received the vaccine under the 3 weeks. We want to make sure that you're monitoring your symptoms for severe headache or leg pain, abdominal pain, etc. And we want to make sure that if you develop any of those symptoms that you make contact with your healthcare provider immediately.